Hello, everyone. This is André Fauteux of 21st Century Housing Magazine. Today, I'm very, very happy to be with Yael Stein. Is that how you pronounce your name, Yael?
Yeah.
Yes. So I just want to show who you are. You are a physician and an anesthesiologist based in Jerusalem, and you were formerly at the Hadassah Medical Center in a pain research clinic in Jerusalem. And now you head Mastella Mifgash. What is that exactly?
I have opened a seminar center for lectures and meetings in topics related to natural health and I don't know, just a meeting place to help people learn things and meet each other, be outside, spend time with nature.
Oh, that's fantastic. Tell me a bit about your background, because when you were doing your specialty in pain medicine, when and why and how did you come across electromagnetic and chemical hypersensitivities?
Well, it started much before then. I had finished studying medicine. I started in 1993 and I finished in 2000. And as a student back then, I used to ask, why do you expect me to use these medications? Because maybe the drug company funded the study, so why should I just believe everything they say? Because they got access to publish it. And back then, it was considered very unpopular to say such things. And come on, evidence-based medicine, who cares if they funded the study? But it bothered me even as a young medical student. And then when I finished medical school, I realized that my dream of being a family physician, I wasn't so happy with it anymore because I saw the family physicians were mostly carrying out what the specialists tell them, which is give this and this and this drug. And I wasn't happy to do that. So I didn't know what to do. I ended up working in administration for a few years and then I went to research. It so happened that the person I went to research with, he was an American who had studied with two great teachers. One of them was Selikov, Professor Selikov, who was an expert in occupational health and environmental health. And he used to say things like, don't wait for the body count. And if we have enough evidence of harm, then we should use the precautionary principle and things like that. And the second teacher my teacher learned from was Professor John Goldsmith, who had been the person who investigated the Pandora Project, the Moscow, what is it called?
Moscow Signal.
What happened in the Moscow
Moscow
embassy in the 50s, 60s, when it was discovered that American citizens who were working in the embassy had been irradiated by the Russians, and the Americans had discovered this and had not stopped it because they wanted to know what would happen. And when it was finally discovered by the public, it became a real mess. And this Professor Goldstein had studied this and published about this. And my teacher, Professor Elihu Richter, was his student, and he taught me these things. And sort of we carried on the tradition of studying these topics. When I came to work with him, it was in 2005 or 6, and he put me in charge of the electromagnetic radiation part of his clinic. It was the Occupational Environmental Health Clinic at the School of Public Health at the Hebrew University. And we had people come in to tell us about their medical situation and ask us to look for evidence in the literature, in the medical literature and the scientific literature, that could explain if there was a connection between their exposures and their diseases. So I got to meet the first, I met many people who had cancer that they thought had to do something with their exposures to antennas and to all sorts of radio devices. And then I met the first electrohypersensitive people in Israel. That I think the first was in 2009. Many of these were relatively young people who had served in the army in positions in which they had been very highly exposed to to utilities and power lines and all sorts of things, and radars and army equipment. And then when they encountered cell phones, their bodies had already been irradiated before so much that they were more susceptible.
Yeah.
And my teacher also had this idea that there was an important interaction between the different sensitivities, the multiple chemical sensitivities, also the fibromyalgia, the chronic, the ones that are tired all the time, chronic fatigue.
Chronic fatigue.
So he was very deeply interested in that, and that started me off when I started my research. And when I came to work there, he put me in charge of the EMF, and he said, here are files of 40 patients I saw of many more, of patients I saw over the last 30 years. I want you to go over all these files and let's make a database and see if we can make a paper out of it. And we did publish a paper, a very important paper, that listed 47 people with cancer following exposure to very high levels of electromagnetic radiation in occupational exposure, in the army, in workplaces, in the police, and as technicians of antennas and things like that. And when we published this, it caused a lot of noise and people were very interested. It came out in 2011. It came out at the publisher was Mattioli from Italy. It's the paper used by the what's the name? I forget, from Bologna. The research, the Ramazzini Institute from Bologna, they published there, and they gave us 30 pages, and we just showed the entire different frequencies and intensities. It was a very thorough paper, but it wasn't a statistical analysis. It was just looking at the edge of the pyramid. So, but after a while, it was just, people stopped thinking about it and everybody forgot about it, and but that's how I entered the field. Only later I went on to become an anesthesiologist, because let's say that there are very few people in the country that get budgets for working on EMF, and I'm not one of those that can be bought, so I'm not paid. So I needed to make a living, so I went into clinical practice. And then what happened was that because I had knowledge in this, people started coming to me for consultation, and they came to the anesthesiology department, and it made no sense. So I opened a clinic at the hospital. It was a research clinic, just to have things written down for these patients, to give them a summary of what they said, and maybe to give them a physical examination, to look at their medical files, for research, not for anything. I couldn't really offer them any treatment. But many of these people just came because they wanted their story written somewhere, and they wanted someone to listen to them. Mm-hmm. So I think that practically I'm the person in Israel who's seen the more people like this than any other physician in the country. I've seen, say, maybe 100. That's a lot.
Mm-hmm. Well, I read a bit about you, and I know that your ethics are, it's something that's very important to you. And it reminds me of a physician I knew in Montreal. He was actually in Brussels at the conference Dr. Belpom organized 2015. And he was a public health physician, also working in environmental occupational health at a big hospital in Montreal. There was a TV news item about a teenager who didn't tolerate Wi-Fi in school. And they went to the clinic, and they showed that on the walls of the clinic, it said, "No Wi-Fi, please shut off your cell phone." And after a while, he told me that his bosses told him that if he wanted to keep working in public health, he should stop talking about electrohypersensitivity. And the College of Physicians, the Order of Physicians, of course, is telling doctors, well, it's not recognized by the World Health Organization, so you're not allowed to pose that diagnosis anymore, because he wrote several letters for several patients to ask that, Wi-Fi be shut off, stuff like that. So I think it's the same situation all over the world. We always think that the grass is greener at our neighbor's property. And I saw that you mentioned that in Sweden, EHS, or electrohypersensitivity, is recognized as a handicap.
Not as a disease, as a handicap.
Yeah, well, it's the same thing in Canada. The Quebec and the Canadian Human Rights Commission say it's a handicap, as who will say you're handicapped, but there's no proof. The studies don't prove beyond a reasonable doubt that it's caused by EMF. So we're going to wait to count the bodies, as you said.
Yeah.
And even in Sweden, I don't know if you're in touch with Mona Nielsen of the Electrosensitive Society there, the association. She's a former reporter. And, basically it's the same thing as here. It will be school principals, directors, or local elected officials who may be convinced and open their hearts and minds and give special treatment to reduce people's exposure. But there's never been a case where the Human Rights Commission accepted a case to go to tribunal. So there are no judgments, no precedents. And it's the same all over the world. But I noticed that in Israel, you banned, the government banned Wi-Fi in, is it daycares, as in France?
I think it's not happening. When in 2010,
yes, here,
in 2010, Sigal Sadetsky was in charge of the field of dealing with it, which was really ridiculous because the Ministry of Health did not have any person dealing with radiation, with electromagnetic radiation, and she was just their consultant. And today she's not their consultant anymore, and they have nobody dealing with this. But at the time, they had at least a consultant. And there was someone at the Knesset, a very environment-oriented person, who said, I would like to have an expert committee, and he put her in charge. He said, I want us to decide what kind of radiation and what levels we are allowing our pupils in school to be exposed to. And she was in charge of this committee, together with someone from the Environment Protection and electric company. They did not want to discuss Wi-Fi. I was there at that meeting, and I remember shouting at them until they agreed to put the Wi-Fi into the discussion. And then she came out with very, very good recommendations, recommending that Wi-Fi not be allowed in daycares and not in kindergartens, and that it should not be used in school, and that there should be line phones, and it should be allowed only for several hours. But none of that is happening. It's just on paper. Practically, Wi-Fi is everywhere, and all of these recommendations are just written on paper and are not being carried out. So it's very nice. I know that the Environment Health Trust like to show what great the situation is in Israel, but it's not true. It's just not happening.
Oh yeah,
it's very difficult for me to believe that there are daycare centers without Wi-Fi.
Okay, so it's not applied. I did write to Dr. Sadetsky many years ago. It's unfortunate because in France they had what they call the Grenelle, Grenelle, which was a public consultation. They have those on all sorts of topics, and I
spoke with them. I spoke with one of them.
Yeah.
I have a good friend in France, and he put me in touch with one of the people on the committee.
Okay. So they adopted the Loi Abeille for sobriety, transparency, information, and consultation concerning EMFs. And so they do have a follow-up because they have a national law. It was a policy, not a national law.
Yeah.
Okay. So the Wi-Fi, it's in the law in France. So hopefully other countries will look at that, because I was going to ask you, why did Dr. Sadetsky propose to remove Wi-Fi from daycares?
No, not to remove, not to install in the first place.
Oh, yeah.
This was 2010. No, there wasn't any Wi-Fi anywhere. And she wrote in that recommendation that there have been studies linking exposure to electromagnetic radiation with cancer, and she sees no reason not to apply the precautionary principle, and she recommends not to put Wi-Fi in any school or kindergarten or anywhere if they can use lined equipment, only if there's some technical reason that they can't use the lines. But then the Ministry of Education, within a few weeks, just turned all her recommendations upside down and did whatever they wanted and started filling every single classroom with Wi-Fi. And I met with her and I asked her, why don't you do anything? And she said, I am just giving recommendations. I have no authority to make anybody do what I want. And if I insist too much and they just won't talk to me, and then nothing will come of it, something like that.
Yeah, no
She didn't have any way of making them listen.
And here we're talking about the head of public health services in 2020.
She was not. At that time, she was not.
Yeah, before, but
she was just the consultant to the Ministry of Health about EMF. And to this day, the Ministry of Health do not have any professional person who knows anything about EMFs. And then Sadetsky became in charge of public health, but that was already a year later, and she didn't deal with electromagnetic radiation anymore. It was like now during the COVID thing, she was just dealing with whatever the WHO told her to do, and not with electromagnetic radiation.
That's pretty sad. I saw that you had this presentation during a conference. If you could please send me the slides, I appreciate.
Yes.
So it's really a basic human rights issue.
Yes, I saw that before. You showed a picture of Daphna Tachover. Maybe go back to it.
Yeah, Daphna in New York State. Yeah.
Yeah, Daphna. She's an Israeli, and she was the person who taught me about electrohypersensitivity. Okay. I met her in 2009. One of the first electrohypersensitive people I met. She was one of those who was exposed in the army, and then became very sensitive. And she told me at that time, she says, there are no physicians in Israel who deal with this topic. I would really, really like to teach you. I've learned, she had acquired a lot of knowledge about this because she was living in New York and became electrohypersensitive when they started the Wi-Fi's in the buildings there, and she couldn't sleep at home. She went to sleep in her car, and she couldn't touch her computer. She became really, really sensitive. So she used to come to my house and sit for hours and just tell me everything she knows, read out all her studies and who she had met and how they'd explained to her this and that. And I ended up meeting and getting to know several of these experts, thanks to her. She was really one of the first people who got me into this. And about the presentation, then I had been studying bioethics, and later on, just last year, I finished my master's degrees in public health. But before then, I'd studied courses in bioethics, and I was very interested in it. And I got into a group that's called the IFT, the International Forum of Teachers of Bioethics, that belongs to the UNESCO Chair in Bioethics, which is an international group. So I went to that conference in 2015, and I asked some of my colleagues. One of them was from Berkeley, Moskowitz, Joel Moskowitz. and one from Africa and one from India. I asked them to join in this project, and we prepared a presentation about basic human rights, because I'd seen patients become electrohypersensitive from smart meters, which means that if they put a smart meter, wireless meter outside the person's home, then that person might not be able to live in that home anymore. And that seemed to be really too much. I mean, you can say a kid can't go to school because of electromagnetic radiation, but they can still at least sleep in their bed at home. But if you put this wireless meter on the wall and the person cannot be inside their home, then I think really you make that person a refugee. It's just too much.
Yeah.
And Daphna told me about this woman from a judge from Germany. She was a woman, a 40-year-old woman who was a judge in Germany and developed electrohypersensitivity in her workplace because of an antenna. And I put that into the presentation, and lots of basic human rights that are being violated here.
So do you think it's one way that EHS will finally be recognized, going through that ethics route? Because politically, it's really the industry and the military who are dictating what the exposure limits are, right?
Listen, I doubt that the military and the government care about ethics, really. I doubt it very much. I think that what is leading them is profit and interest, and ethics is not what is leading them. So if you ask me personally, I think it will take a while until it will be recognized. But perhaps because fibromyalgia has been recognized, and many people who have electrohypersensitivity end up developing fibromyalgia. Now, I'm not a rheumatologist, but from what I understand, many of the environmental symptoms, if they're not treated, worsen and worsen, and the people end up becoming debilitated and developing some chronic disease such as fibromyalgia. And if they have that, then they might get their social rights, the wrong way round, but they might get it. It's not the way we would like it to happen, but I doubt very much that any government or any town is going to change its policy because of ethics. They really don't care about that, unfortunately.
Yeah, it's pretty sad. I'm fortunate, as reporters, we're able to speak to so many experts, and I had the pleasure of meeting Dr. William J. Ray twice. Bill Ray, who founded the Environmental Health Clinic.
I've heard of him. He's
such a nice man.
guy.
He saved so many physicians who were chemically and electrically sensitive. He saved their lives. They went down to his Dallas clinic, and that's how they understood how it works. And Bill came once to the Royal Victoria Hospital in Montreal because there was a surgeon there who was chemically sensitive, who introduced me to him. She could not operate without having 2 or 3 masks, HEPA filters and everything. And she never told her colleagues, please do not wear perfume, it's making me sick, because she didn't want to be shunned. That's what everyone with environmental health hypersensitivity, that's their daily routine. You keep.
But I have to tell you that I developed a kind of chemical sensitivity from face masks.
From the masks.
Yeah, that's why I ended up leaving the hospital.
Really?
Because I had been sensitive probably to some of the chemicals in the masks when I was doing my residency in anesthesia. Then I would itch all day long from the masks, but we would use them only in the operating room, and they could be worn loosely because the colleagues always had the discussion whether the anesthesiologist really needs a mask, because the masks in the operating room are there to prevent you, putting germs on the wound, on the surgical wound. So if you're sitting far away enough, then technically, there is really no proof that the anesthesiologist actually needs a mask,
You're not
except
over
when
the
you're on the patient doing the anesthesia. But when you're just sitting in the corner of the room, it's not that, that sure that it's really required. So you could wear it loosely or something, and I was okay. It was okay, a bit itchy, but not too bad. And then when they started saying you're not allowed to take it off, and you have to wear it tight, and you have to wear it all day, and I used to walk around with it a whole day, already, allergic to some of the components, and I developed very, very severe chemical sensitivity, and I started fainting in the operating room. I became sick. I became terribly sick. That's why I left the hospital. So,
Your health comes
you know,
first, and the health of your patients too. That's incredible. It's interesting that you talk about the wounds. You're not over the wound, but Dr. Ray was over wounds for many years. He was a thoracic surgeon. He became chemically sensitive, I think, in the 60s or 70s. And it was an allergist, Theron Randolph, who treated him.
Oh, I didn't know that. Interesting.
Dr. Randolph is the pioneer who coined the term clinical ecology, which became environmental medicine. Dr. Randolph used to sit at his desk with a typewriter before computers. Yeah. And he would write for an hour or two everything the patient said, everything from A to Z. And that's how he linked all the different environmental exposures. And Dr. Ray said, if you don't clean the wound, you're not going to cure the patient. So you have to remove all the pollutants from the environment, or else you're triggering the symptoms. And there was an interview with him many years ago where he said what the triggers of electrical and chemical sensitivity are. And do you know Lisa Nash? Lisa is an emergency physician, specialty, who was treated by Dr. Ray. She's in Martha's Vineyard in Massachusetts and has the environmental health clinic of Martha's Vineyard. She was really sick, really, really sick. And she believes the main trigger is mold.
Yes, I met Tamara Tuminen from Finland, who wrote a very good paper about this a few years ago. She was looking into chemical sensitivities and the relationship with mold. She wrote about a police station in Finland, that the officers there were breathing in very humid conditions because they didn't open the windows, and it's cold in Finland, so they keep everything closed, and they had mold. And she really showed a statistical connection with exposure to mold. And she was one of the people who helped me when I suspected that what had happened to me was connected to the masks and the humidity inside the environment, that you breathe these chemicals in this humid environment.
Well, I've been writing about healthy housing for 30 years, so I know that in building materials, the hotter and the more humid it is, the more VOCs, volatile organic compounds, come out of the materials. Yeah. The reason I'm talking about the triggers with Dr. Ray is that when I talk about environmental health for sensitivities, people tell me, well, I'm not hypersensitive. So then I ask them, do you have allergies? And the triggers, not only mold, but it could be pesticides, concussions, heavy metal poisoning. Dr. Ray put so many metal implants into his patients that act as antennas. And medical errors, medications sometimes can make people hypersensitive. So the list is very long. Carbon monoxide is a big one also.
Yes. I've seen someone who became electrohypersensitive, that he had 20 years ago been poisoned by carbon monoxide in his car because the exhaust wasn't good. And then he became very, very sensitive. I wanted to say something about the concussions. What I said at the meeting at the European Parliament, I gave them a summary of how I saw the clinical, natural continuation of the disease, or how, I don't know how to call it exactly. And what I saw, that in the beginning, patients have something, and they feel something after they talk on their phone for a while, or after they're exposed for a while, and then when they finish, then it disappears. The second stage is that they get it faster and it stays for longer. It can stay for hours or for days, or it can start several hours after they're exposed. Suddenly they get this terrible migraine and they don't even connect that it has anything to do with their exposure. And the third stage is when the people just have some terrible symptom, their own specific symptom that keeps repeating, and it doesn't go away. They just can have it for weeks, a migraine or terrible pain in somewhere in their face or their ears or their jaw, and they keep having that. And only after they make real changes does it subside or begin to change. And I think here the most important thing that I've noticed is that the sympathetic nervous system is overactivated, and what stops it is that people do things to activate the parasympathetic nervous system, which can be breathing exercises, qigong, getting out of the news and the rush and starting doing things more slowly and gently. So that's one of the things that helps a lot. And what I noticed about the background of these people is that many of them do have some genetic changes. If you were to check, if you were to look into it, you would find that some of them have not fully functional detoxification genes for liver functions, things like that. The person that I read this information, there's a very good book written by John Molot from Canada, Molot. I got this book from a friend and I spoke with him. He's an environmental doctor. He wrote 12,000 Canaries Can't Be Wrong. It's an excellent book and it gives a lot of information with thousands of references. So he wrote about this detoxification systems that aren't functioning properly. And besides that, I noticed that many of the patients, they had some kind of, I call it priming, some kind of event in their very early childhood, 6 months, like they can have a response to a vaccine, or maybe a fall, or maybe the parents got divorced, or something happened to them when they were very, very young. Then many of them have a long-term exposure to something. It can be to paint, or it can be to VOCs, it can be to electromagnetic radiation, the very low doses, or to air pollution. And then at some stage, or it can be something more. It can be in the army, like they're exposed to wireless or radars. And then they have a trigger. Something happens that they become hypersensitive. It can be a road accident. It can be a concussion. It's something that affects their nervous system. They can fall from a ladder and suddenly everything that happened before becomes electrohypersensitivity, just like that. And they didn't have it before. It's incredible because usually people don't connect. They don't understand what the connection is, but it's the buildup of all these things together in their bodies, and then something happens. It can be even after an emotional trauma, a very difficult divorce, or I don't know, something that happened to them, and suddenly they become hypersensitive, and then they become like really, their lives fall apart, and it takes a while for them to get that.
Yeah, I'm looking for a slide where Dr. Belpom said, do not wait to have the symptoms so advanced that the disease is really set in when you have, I think, memory problems and other more serious. As soon as you get headaches or pain in the ear, you should stop using your cell phone because it can degrade your condition. Tell me about the hope, though. Some people do recover.
Well, first of all, I agree totally with Belpom, because if you catch it at what I call the first or second stage, before they go down the pit, as I call it, when they become totally sick, then I believe that many of the symptoms are still reversible. And I ask people sometimes, have you ever experienced that you just walk down the street and you feel, oh, I think a call is coming in my cell phone, and you put your hand in your pocket because you feel your muscles contracting and the cell phone is not there. The muscles are responding because they're already used to, they've already become hypersensitive, and they respond when you pass next to an antenna, and that muscle feels the electrical change, then it contracts. That person is already electrohypersensitive in some way. And at this stage, they should reduce their use, because this could still be reversed, because it's not too bad. And someone once asked me, he said that he has tinnitus in his ears and he lives on a roof and there are 3 antennas next to him, and can it be reversed? So I told him, listen, you know, you're at the stage, you're just at the 1 second before there's nothing to be done. I suggest you do something about those antennas or move, because after it becomes sort of a permanent symptom, then some of these cannot be reversed. And Daphne Tachover, I remember she told me that there is a triggering event that you remember. Every person remembers when it happened to them. Like I remember once when I felt my entire jaw becoming a hot and having electricity go through it. And since then, I've been a little bit sensitive. And she said the reason is because the blood-brain barrier has become opened, and then it can't be really closed. And look, there isn't 100% evidence for this, but there is evidence. There is enough evidence, and Belpom has shown things like myelin O in the peripheral blood that should not be there really in healthy people. And I forget the name of the researcher, a very good researcher from Europe, who has shown several studies about blood-brain barrier being opened. And people have told me, oh, but that's at very high levels of radiation and it doesn't count. Well, I told my colleagues in the pain clinic, you use pulsed waves to reprogram nerves that you want them to stop causing chronic pain. Well, you know what? It happens when you do it, and it happens when someone else does it. It just happens when that person is exposed to pulsed waves, whether you want it to happen or not. You can't say this works only when I do the mechanism, but other times it doesn't work. That just doesn't make any scientific sense. It either works or it doesn't.
It was Dr. Salford from Sweden.
Salford, Leif Salford, that's the man. Yeah, he has a team and they've been doing a lot of research on it.
So what do you tell people when they say, well, I'm not sensitive, it doesn't concern me?
Good for them. Look, there are several things to say about that. First of all, sometimes it's good to be sensitive, because if you are sensitive, then you will reduce your exposure, and it won't happen that you might develop cancer from being overexposed without knowing it. So the hypersensitivity actually protects you from exposing yourself too much, because you say, I think this is enough for me, my body can't take any more of this, I'll just reduce. The second thing is that, as we saw from the Russian embassy situation, the ambassador there, several ambassadors got leukemias or lymphomas, and then eventually the government had to look into it because they just couldn't hide it anymore. And the people there were exposed to very low levels. Like if it's allowed today to be exposed up to 1,000 microwatt per centimeter square, they were exposed to up to 18 or something. That is their exposure. They were not exposed to such high levels, but the modulations of the signals were random, like Wi-Fi.
Explain what the modulation is. It's different frequencies that are piggyback. It's the message that's on the.
It was just scrambled signals that, that make the brain have to work all the time. From what I understood, there are several mechanisms here. One is that the brain cells really try to perceive what the message is. They think there's a message hidden there, and they're sort of working all the time, and that's why the sympathetic nervous system is sort of working. It's like it never has peace. It never has peace and quiet, and it's always trying to find out what this information is saying. So these cells, even if it doesn't cause cancer by itself, the cells are too busy and they have no time and no energy left to perform their basic functions, which is even basic things like if a mutation has been caused in a cell because of a different carcinogen, these cells have to be available to deal with it, to get rid of the mutation and to clean up. And if they're busy perceiving signals from the Wi-Fi, then they don't have time to do their regular job.
Yeah.
So it also causes premature aging of the cells. They're just so busy all the time.
That's
The
what
second thing,
Magda Havas calls it.
yes. And the second thing is that, wait, there's two more things. The second thing is that the brain sees the waves as light. So there's no melatonin. During sleep, you're supposed to have darkness, and then your brain emits melatonin, which helps you. It's also an antioxidant. So it just doesn't do it because it thinks
also a cancer fighter, melatonin.
Yes. And the third thing is, which is very important, especially for children in schools, is that the Wi-Fi has what is called the beacon frequency of around 10 hertz, between 8 and 12 hertz, that tells the devices that it is available for them to connect. And while we're awake, our brain uses beta waves, which are faster than that. But when we try to calm down, try to sleep, to meditate, or when children are studying new things in school and they want to concentrate, then our brain uses alpha waves. I think Andrew Marino has done a lot of research on the EEG changes. And the alpha waves are between 8 and 12 hertz, and they just clash with the Wi-Fi, with the beacon frequency of the Wi-Fi. So if someone wants to sleep, the first thing they should do is just turn off all these smart devices. And I think the good news that we can tell people are very much afraid of antennas and all that coming from the public space. And I agree, I wrote a medical opinion about the 5G and its risks. But I think that we could start with the personal use inside the house, because the greatest exposure that everyone has is from their own devices that they choose to use inside their house. And if you have an antenna outside and you have no device that can talk to it inside the house, then it will have a much more difficult time coming inside your house and irradiating you. It needs to have those devices inside your house talking to it. So if you just put them all out of the electricity or don't have them in the first place, then whatever is in the public space doesn't really have to bother you that much. You make the personal choices, and if you irradiate yourself inside the house, then you can't really say it's anyone else's fault. Like, take responsibility, and you don't need to have a good reception of Wi-Fi in your baby's room or in your bathroom. You just don't need this. I don't use Wi-Fi at all in the house. Everything is wired, and there is a router, but its Wi-Fi abilities are off, and I have a long wire, and then if I want to connect it, I connect it and I use it. All of these devices are just, I don't know, people have become sort of, all they care is convenience, and they don't care about health, and then they expect others to have the ethics to care about their health when they are irradiating themselves. So what do you expect?
Because they don't realize that the signal can be really powerful in their house. And it's the fact that it's pulsed. When you mention the fact that it's modulated, everything which is digital is 0 or 1, so they stop and pulse it, and that's what is really very, very harmful to our cells.
Wait, I saw this very good slide that you put up. This researcher, Panagopoulos, I think his name is, from Greece.
Yeah.
From Greece. He is really one of the leading voices today,
Yeah.
and he does exceptional work. And he is published several times. He now has a study like this from 2020 that really gives a full picture. And he says that all the man-made electromagnetic fields are very different from the natural ones. The man-made ones are differently polarized, and they affect the body differently. And he sees that as a key factor. He says, don't come and tell me that you're exposed to the sun, and that doesn't do anything to you, so why should that do anything to you? Because these are completely different things and they affect the body differently. So the physics theories saying that this radiation in theory should not be able to affect you are just it has been proven that they're not true, because it just isn't happening. The things do affect you, and biologists have shown that they affect you at much like a millionth of the allowed levels. They already affect your biology. So theory is nice, but just doesn't
Yeah,
work.
but people are really lied to by the scientists and the governments, because we know that the military since the 1950s have published about all the electrosensitivity symptoms. As you said, the exposure levels were not necessarily as that high. In schools today, some of the routers for Wi-Fi are industrial grade, extremely powerful. I was at a friend's place a couple of weeks ago, and his wife had 5 episodes of tachycardia or heart palpitations when I was there. We were leaving, me and him, for the weekend. He didn't want to leave. And I said, well, I have my safe and sound meter in my car. Do you want me to measure the microwaves if you have Wi-Fi? They said, okay. So we measured 70,000 microwatts per meter. And
wow, that could kill a person.
well, we know that in building biology, we should be under 1,000 or ideally under 100 in your bedroom. And that Health Canada, for instance, and other governments will say, well, 4.5 million is safe because it's a thermal
funny.
limit.
If it wasn't so sad, it would be funny.
Yeah.
Yeah.
And all the governments only go by the thermal limit created by industry and the military. If your body doesn't heat up by 1 degree Celsius after a 6-minute exposure, there is no danger, because all the non-thermal biological effects studied, nothing is conclusive.
Yeah, I know. I met Om Gandhi in the United States in 2012.
Who?
He was one of the Om Gandhi, Professor Gandhi.
Yes, Professor Gandhi. About the
He is from
penetration in the brain.
Utah. He was one of the experts who did a lot of research for the US Army or Navy, I don't know, in the 1970s and 80s. And together with a researcher called DeAndre, they did the experiment on mice that heated them, and then showed when they were heated enough, they stopped pressing the buttons or whatever. It was one of the very important researchers that set the standard. And then many years, like several years later, maybe 10 years later or 15 years later, he was one of the first who made these computerized models. He called it the Utah Man, based on MRI, showing like the real tissues from the MRI photographs, because he said he wasn't happy with all these liquids that, like, when the cell phones were tested, they just had this doll called the SAM, and they fill its head with liquids. And he said he didn't feel that this was really a very good test, and he wanted to have a better one. So he developed computerized tests, and then he noticed that the safety standards were not good enough, and he started telling people about this and publishing about this. And then they closed his lab, took away his funding, And he wasn't such an appreciated member of industry anymore. But he kept his ethics, and yes, that's and he's been very active, saying what he believes is true, that the standards are very far from protective, especially for women and children. Perhaps for very big men, it's good enough, but that's it.
Yeah, I think we're gonna have to do another hour because I have to go to an osteopath. I play hockey and I had a little accident last week. You've taught me things. I'm going to look into the alpha waves issue. I have to write about that. It's very, very
Great.
nice meeting you.
Thank you very much. It was a pleasure.
So let's do it again.
Okay, we'll find time.
Take care.
Okay.